Good morning, everyone. Thank you for joining us for Indiana SHIP's Medicare Monday. I'm Susan, and I'm joined by my hostess, Megan Rogers.
Morning, Susan.
Good morning. And good morning, everyone. And this morning's topic is how Medicare covers cataracts, cataract treatment, cataract surgery. And Megan has prepared a terrific presentation to take us through that. If you're watching this live, do feel free to chat in your questions on the Facebook page and we'll ask Megan. I'll be monitoring those. If you're watching this as a recording on our YouTube channel or on Facebook later, go ahead and ask us questions anyway. Megan and I keep an eye on those and we will respond to you. So without further ado, Megan, tell us all we need to know about Medicare's coverage for cataracts.
Wonderful. Thank you, Susan. Let me get the PowerPoint up here. All right. So I always like to start with some facts, or usually I do. June is Cataract Awareness Month. And a cataract, what is it? So this is a clouding of the eye lens that blocks or changes light's passage into the eye. It is a very common medical diagnosis, and it happens with age. My mother, father, and grandmother all had cataracts and went through the cataract surgery. There are over 24 million Americans aged 40 or older that have cataract, and it is the leading cause of blindness. 95% of vision loss due to cataracts can be restored. And it's one of the most common surgeries that happen in the US. So there are 2 million cataract surgeries performed yearly. The most common ages for people with cataracts or who have cataract surgery is age 70 to 79. There are 40% lower mortality rates for patients who had cataract surgery, and 16% decrease in odds of hip fractures after surgery, because now you can see, so now you're probably not tripping over things. All right, so let's dive into Medicare and cataracts. So generally, this is a surgery that's covered by Part B. Part B is our outpatient part of Medicare. Most outpatient or most cataract surgeries are outpatient. When my grandmother had her cataracts, we went to an outpatient surgery center. With my dad, because he needs a Hoyer lift, we did have to have it in the hospital. However, he went home right after the surgery, so it was still an outpatient procedure. So Part B is the one that is generally going to cover your cataracts. So 80% of the cost of cataract surgery is covered under Part B. If you have a secondary insurance, like a supplement, your Medigap, Medicaid, maybe retiree insurance, that remaining 20% would most likely be covered. And we'll talk about Advantage plans in a minute. And the coverage is same whether or not laser technology is used. Medicare covers the most common lenses involved in the cataract surgery. It doesn't cover all types of the lenses that they use, though. So keep in mind, if you do go for a special lens, you may have an out-of-pocket cost. I actually had a caller last week who is having cataract surgery. She has original Medicare, and she has a Plan F supplement. And Plan F covers everything with your medical part of your Medicare. So your deductibles, your co-pays, nursing home co-pays, all of that. Well, she got a bill for $400 and she didn't know why. And I was like, well, I think you need to call them back, because it's very possible that you got a lens that isn't covered completely by Medicare. Or it's possible that's just the estimate and you didn't need to pay anything. So she called me back the next day and said, "You were right. I got a special lens, so I had to pay for the upgrade." Okay. So problem solved. We knew that Medicare was paying their portion correctly. The supplement was paying their portion correctly. She just chose or needed a lens that's a little bit more of an upgrade, and that's why she had to pay that $400. And then most Advantage plans will cover the cataract surgery. And keep in mind, Part B, it usually covers more than just the surgery. They're going to cover the eye exams to diagnose serious vision problems. They're going to cover the pre-surgery eye exams, the anesthesia during surgery, the removal of the cataracts, your basic lenses, and once you have either the one eye done or both eyes, depending on what you need to do with your cataracts, Medicare will also cover one pair of prescription eyeglasses or contact lenses after the surgeries if you need those. You may not even need eyeglasses or contact lenses after the surgery. When my dad had his, he no longer needed to wear glasses. Or maybe your prescription has changed because of the surgery and you need an upgrade with your eyeglasses or your contact lenses because of that. And then they'll also cover up to 1 year of any follow-up care that you need. All right, so cataract surgery is covered by Medicare Advantage plans. Your out-of-pocket cost might be different than if you had original Medicare and a Medigap. So it's going to depend on your premium, your deductible, copays, and the specific Advantage plan that you're on. You want to make sure that the doctor that you're seeing that's doing the cataract surgery is in network. The hospital or outpatient surgery center that you're going to also takes your Advantage plan. Keep in mind when you're on an Advantage plan, you're not calling your providers and asking if they take Medicare. You have to ask if they take that specific Advantage plan. United Healthcare Choice Plan PP or PPO1, whatever is on that card. So we kind of touched on this, but what if you need new glasses after surgery? So normally, Medicare does not cover your routine eyeglasses or contact lenses that you go to see your eye doctor for every year or every 2 years. But because cataracts are a medical diagnosis and it's a medical surgery, your Part B will help pay for corrective lenses after the surgery. And like I said, if your prescription strength has changed with your glasses or contact lenses, Medicare will cover that. Now, they'll cover standard frames. So if you want fancy, pretty eyeglasses, you may have to pay an additional cost that Medicare does not. Kind of like the client I had who went with higher lenses for the cataract surgery, she had to pay extra. So if you want fancy eyeglass frames, you might have to pay a little extra too. Well, I already covered this a little bit too, but we'll go through it. What if you need more than just the basic lenses? And we're not talking about the eyeglass lens, we're talking about the lens in your eye, actually. So Medicare will cover the cataract surgery that involves that basic lens implant. There's small clear discs that help your eyes focus. So Medicare will pay for that basic lens, but it's not going to cover more advanced implants. So if you're a provider, is recommending more advanced line implants, you might have to pay for that upgrade. So that one client I had, she paid for a $400 upgrade for more advanced lenses. So it is important to talk with your healthcare provider before the surgery so you understand if you're getting the basic lens, if you're getting an upgrade, what is your Medicare Part B going to cover, what is your supplement going to cover, or Medicaid, your Advantage plan. So you want to make sure you know those costs and you have that conversation with the office that is doing that surgery. So some things that you want to find out before surgery is, will you be inpatient or will you be outpatient? Again, these are generally outpatient, even if you go to the hospital. I've never encountered a client that has had an inpatient cataract surgery, but there could be circumstances. You want to make sure that you understand that though, because if it is inpatient for whatever reason, your Part A is going to cover that. And then outpatient would be your Part B. You want to verify that your doctor and the facility that you're having the surgery done does take original Medicare, they take your Advantage plan, they take Medicaid, your spouse's employer insurance, your employer insurance, a retiree plan, whatever you have. Again, you want to have that conversation about what you will pay for the surgery. You do want to find out which prescriptions you might need afterwards. When my dad had his, he was sent home with probably 4 or 5 different eye drops that the nursing home would have to do for him. Some were just for a day, some were for a week, some were multiple times a day. So you do want to make sure you know what's happening, what prescriptions you're going to be provided at the outpatient surgery center or the hospital, what prescriptions you might have to pick up. So when the nurses at the hospital handed us the eye drops for my dad, the hospital provided those. So that cost is bundled in with the Part B costs of the surgery. If any of the eye drops or other prescriptions are being called into the pharmacy for you, then that would be covered under your Part D. And you want to make sure that it is covered by your Part D provider. And then you want to check if you have any deductibles or any out-of-pocket limits. All right, Susan, any questions, thoughts, or comments?
Well, no questions right now. I do have a thought, and I would just like to say thank you for this presentation. You know, most people in their lifetime will have cataracts removed.
Yep.
And so these focused one topic presentations are really helpful.
Thank you, Susan. I appreciate that. And this is one of my favorite presentations to do. So I was happy to do it. So like Susan said earlier, feel free to chat in on the chat box for this recording. We do monitor those. If you want to talk to us more in-depthly, you can send us a Facebook message. Susan and I also watch for those and respond to those. You can call us at our call center, 1-800-452-4800. You can go onto our website, medicare.in.gov, and you can find all the local SHIP sites in Indiana. And you could call one of those agencies directly as well to get local help with a SHIP counselor. You can follow us on social media. If you're watching us on Facebook or YouTube, you already follow us, but we are on Twitter, we're on Facebook, we're on LinkedIn, we're on YouTube. So without further ado, Susan, would you like to tell us what is coming up?
Yes. So unbelievably, it's June 1st. And we have 2 more Facebook Live programs. First one coming up is our What to Know Wednesday on June 10th at 10 a.m. Eastern Time, and we're going to be talking with a partner agency. Find out about what they do, how they incorporate Medicare counseling and other SHIP duties with all their other services. So tune in. I know you'll love Sue Ann is going to join us, and she is terrific, and I know you'll love her. Okay, then we're going to end the month with another Medicare Monday about avoiding common pitfalls with your Medicare. You know, sometimes information that you receive or that you think you might understand might cause you to make some interesting decisions. And we have kind of honed in on what are some typical mistakes or pitfalls that people experience when they're getting their Medicare benefits. We've also started a Lunch and Learn series. This is at noon Eastern Time, once a month. And June's topic is going to be how Medicare covers skilled nursing care, another focused topic. So that's June 18th at noon Eastern Time. Grab your lunch and join us, and you can hear all about how Medicare covers skilled nursing home care. We also have an extra bonus. This is our evening quarterly webinars. It's a live webinar, so you can interact with us. Now, these are not recorded, so only being live, you've got to tune in. But we do these every quarter in the evening. So at 6 p.m. Eastern Time on Thursday, June 18th, you can hear all about being new to Medicare. We're going to talk about all of the decisions, timing for those, the rules. So get a good overview of being new to Medicare. If you're old to Medicare or an experienced Medicare beneficiary, I like to say, it'll be a great overview. So it's not just for new people. It's a really good, thorough overview of Medicare benefits. And then we will zoom into July and we will let you know about those topics soon. And those have been posted, I believe, on our Facebook page.
Yes, June and the Lunch and Learns and the New to Medicare are posted on our Facebook page. We will get July and on up within the next couple weeks.
Right. The other thing that you may have noticed on your Facebook feed is our Fun Fact Fridays. So each Friday, Megan and I post, one of us, talking just a quick little ditty about some aspect of Medicare. So we hope you enjoy those. If you have suggestions for topics you'd like us to cover, go ahead and let us know, and we'll make sure that we respond to those and give you the topics that you're most interested in. So, Megan, thank you for a terrific discussion on cataract surgery and Medicare coverage. And I hope you have a great day. And I hope everybody that's watching has a great day.
Thank you, Susan.
You're welcome.
Bye, everyone.